My name is Sally Callow. I'm both an ME advocate and ME sufferer. I'm also the creator of ME Foggy Dog. It's a very light-hearted campaign sending a soft toy around the world to raise awareness and funds for the ME Association in the UK. I'm making this short clip just to try and explain on a very basic level what ME is for anyone that's not come across it before. My knowledge of biology is rubbish, so this will be jargon-free and hopefully very understandable. So, let me break down what the words myalgia and encephalomyelitis actually mean. So, my means muscle, algic is pain, encephalo is brain, and myelitis is spinal cord inflammation. So basically it affects most bodily systems. So no two patients are the same. My symptoms will be completely different to another sufferer, whether it's the level of severity, or maybe I've got 20 out of 30 symptoms and they've got 25. So we haven't all got exactly the same, which is why it's incredibly difficult to diagnose. There is no test to diagnose ME, it's just a symptoms-based diagnosis. So it takes an incredibly long time to get diagnosed, and when you go through that process of being diagnosed, you experience an awful lot of misunderstanding from the healthcare profession. That's one of the biggest battles that sufferers face, is being believed and actually getting that diagnosis in the first place. We need so much more research, which is why I am an ME advocate, to try and raise money for that research. ME affects 17 million people globally and 250,000 people here in the UK. But there are no known causes. At the moment, there's a theory that we were kind of born with some kind of virus in us, and then we have some kind of trigger. So that could be another virus, or an accident, or grief, or severe emotional trauma. For me personally, it was an ear infection. I had ME both in my childhood and in my 30s, and I've had it for 9 years now. So I'm no better off than I was 9 years ago. I just have to go through it on a daily basis. This slide shows most but not all ME symptoms. As you can see, it's not just tiredness. ME is also known as chronic fatigue syndrome. Depending on where you live in the world, it's known as myalgic encephalomyelitis, chronic fatigue syndrome, post-viral syndrome, and a couple of other things as well. But I'm just going to stick to ME for the purpose of this video. Okay, so when we say tiredness, we don't mean just, oh, I'm a little bit sleepy. We mean I'm so tired I can't function. My brain doesn't quite know where my limbs are. I can't move easily. Until you have ME or some other disorder that makes you incredibly tired, you don't realise how much energy it takes to think, move, communicate. Because if you think about it, even talking, you're using energy to move the muscles to make you talk. You wake up exhausted, doesn't matter how much sleep you get. One of our symptoms is unrefreshing sleep. So you never have that, oh, I feel so much better after a good night's sleep. No. So many people say to me, you just need a good night's sleep, because I'm always awake by about 5:30 in the morning. And so many of my friends say, the reason you're so tired is you don't sleep well. It wouldn't matter if I had 10 hours sleep, I would still wake up exhausted. Cognitive issues is a huge one. For me personally, when I'm getting more and more tired, I get slurred speech. I find it difficult to communicate, as in I can't string a whole sentence together, or I might have to stop midway through a sentence and just wait a second till my brain catches up and then carry on. Quite a lot of the time my friends have to fill in gaps where I've just completely grind to a halt and I've forgotten what I'm trying to say. The reason my campaign is called ME Foggy Dog is because of brain fog. Brain fog is essentially like trying to get a thought from your brain out, and it's like wading through cotton wool. You just can't get that thought process to work properly. Word finding abilities is a huge one. I make up words all the time because I can't actually think of the word that I want to express. Pain I personally don't suffer from the pain side of ME, but pain can be so extreme, like nerve pain, that it takes your breath away. That's partly why sufferers are bedbound, housebound, because just moving is exceptionally painful. Post-exertion malaise affects muscles as well as cognitive issues and everything like that. It's essentially exactly what it says on the tin. Post-exertion malaise is when you exert yourself too much, or not even too much, it could just be popping to the shop to get like a bar of chocolate or something, that if your body doesn't like it, it will pay you back for it in 24 to 48 hours later. So ME sufferers call that payback. So, you know, your body's telling you off for using energy that you haven't got. With the immune system, there's quite a few symptoms. The ones I'll concentrate on now are temperature control. So on very hot days, I'm inside under 2 duvets, fully clothed, thermals, the lot, trying to warm up. My body just doesn't have the ability to keep my body at the right temperature, so I overheat and I get over cold. When I get tired, I tend to go icy, and I don't just mean if you touch my skin it feels a little bit cold. I probably feel warm to the touch, but inside my bones feel cold, like very internalized icy feeling. And it just doesn't matter how many layers you've got on top of you. You could be cuddling a hot water bottle, you got goosebumps. It's awful. It's not a horrible feeling knowing that you can't warm up. Sore throats and I guess glands and lymph nodes are connected because our body's fighting to get to regulate itself. Your glands play a part in that, so you have swollen glands as your body tries to control the bodily systems. And every day I have a sore throat. It's funny, when I used to work, because I'm currently in between jobs, when I used to work I used to complain of having a sore throat, and people would say, oh, stay away from me if you've got a cold. And it's like, no, this is ME sore throat. I haven't got a bug, this is just my glands are trying to regulate everything and it's coming out in my throat. Makes my voice croaky, makes talking painful, and I know that is a common ME symptom. So but yeah, gland issues, so you've got glands all over, haven't you? So glands in your neck, I find that glands along here are extremely painful. Armpit glands, groin glands, they all like puff up, get swollen and achy. Headaches are very common. But then you also get flu-like symptoms, so headaches and flu-like symptoms. I think it's literally because your body kind of goes into this reaction mode, almost if it thinks it's being attacked by a virus, so it's constantly on high alert, and that means getting your lymph nodes to work overtime to try and fight it off. But there isn't a virus. It's like, all right, there's nothing wrong, just everything needs to slow down. But yeah, feeling like you got flu is like the baseline. So imagine every day waking up and feeling like you have flu, and then it just goes downhill from there. You never feel any better than having flu. So when people moan about, oh, I feel really fluey today, it's like, if I told you every time I feel fluey, it'd get very boring. Symptoms are fluctuating. So some days are better than others. Even if you've rested for 3-4 days straight, maybe you've, maybe you don't work, maybe you sit at home and you relax, and your partner says to you, oh, I want you to relax as much as you can. It doesn't matter what you do, your symptoms will fluctuate. And obviously if you push yourself, or you can't push yourself, but if you attempt to push yourself, your body will pay you back threefold. All your symptoms will treble, and it's a horrible illness. And I've only got, like I say, I've only got mild ME, and has a terrible effect on my life. But I consider myself exceptionally lucky that I'm not a severe sufferer. I'm very grateful for that. So I might look fine on the outside, but I never feel better than having flu. Yeah. Okay, so who gets it? Anybody is the answer to that. we don't know what causes it, so we don't know why some people recover from illness and trauma and others don't. So children get it. It's actually one of the most common causes of school absence. 1 in every 100 secondary school children between the age of 11 and 16 have it in the UK. And the youngest child ever to be diagnosed was 2 years old. So it's not a lifestyle illness. It's not like they've burnt out or pushed themselves too hard, or, I don't know, been an alcoholic, or, you know, whatever. There is no known cause. You can't tell me a 2-year-old was an alcoholic, or, you know what I mean? So it's nothing that we're doing that triggers it. But yes, it's very common to have ME in both your childhood and again in later life, so in your 30s. For example, I had it in my childhood, in my teenage years. I was between the age of 13 and 15, but then mine also started 2 weeks after my 30th birthday. So I'm pretty much a stereotypical ME sufferer. I have had it twice. It affects any age and any level of fitness. It's actually, since I started my advocacy, I've been astounded by the amount of people that used to be marathon runners, triathletes, is that a word? Very physically fit, or have very, very high-powered jobs. You know, they're not lazy, they're not looking for an excuse not to work. Most ME sufferers are the type of person that push themselves hard, either physically or mentally. Physically fit people are essentially cut down in the prime of life. That's why we need to find out what causes it, because we're losing an awful lot of talent and ability to this dreadful illness. Okay, so the biggie is severe lack of government funding. It's a worldwide issue. It's not just the UK government or the American government, it's every government. Even if they're not thinking with compassion, they're missing out because of these people that aren't able to work. Like I say, I'm able to work, I'm just in between jobs at the moment, but there's an awful lot of people that are on disability benefit. Now surely it makes economic sense to get those people back to work, or find a treatment that allows them to be able to go back to work, even part-time. They can contribute. They all want to contribute, but we can't because there is no treatment. You know, you might have sleep problems, so you're given sleeping tablets. You might have nausea, so you're given anti-nausea tablets. But there's no specific treatment to sort the ME out at its root cause, and that's what we need. Unfortunately, misunderstanding of the illness means that sufferers and their families do most of the fundraising and awareness raising. It just seems ridiculous to me. We've got the least amount of energy and cognitive power, and we're the ones that have to come up with ways to raise money because the governments aren't giving us that funding. It's very hard to raise awareness of an invisible illness. As you can see, I look fine. I'm not sure if I've been slurring throughout this video, but I wouldn't be surprised. It could affect absolutely anybody. It could affect you or one of your loved ones at any point. And that's why we need to know what causes it. Need to break down the misconceptions that it is just tiredness. It's not. It's an all-consuming, all-system affecting, horrible disease. ME does not discriminate regardless of age, race, ethnicity or sex. We need to wake up and realise that 17 million people around the world are suffering from this dreadful illness, and in many instances aren't believed. That's something that needs to change.